My name is Aaliyah Byers, and I'm a junior at Winston-Salem State University, and my major is healthcare management.
My name is Taylor Daniel, a healthcare management major, junior from Durham, North Carolina.
My name is Ebony Douglas, healthcare management major, junior from Fayetteville, North Carolina.
My name is Jordan Grier, healthcare management major, junior from Charlotte, North Carolina.
My name is Ladayzha Foster. I'm a senior from Henderson, North Carolina, healthcare management major.
My name is Kiriana Gilmore. I'm a junior healthcare management major, and I'm from Greensboro, North Carolina.
What is an EHR system? An EHR system is an electronic recording of health-related information about people who can create, collect, manage, and create consultation by a certified clinicians and staff health organizations, usually sourced using a third-party software package. You can identify and maintain a patient record, manage patient demographics, manage medication list, manage patient history, manage clinical documents and notes, capture external clinical documents, present care plans, guidelines, and protocols, manage guidelines, protocols, and patient-specific care plans, and generate and record patient-specific instructions.
Okay. EHR examples, system that is focused by a physician, and also a data is stored on a physician's personal servers. It's a system that is hosted remotely. The storage of the data is moved from the physician to a third party with remote hosted systems, and it's systems that are operated remotely. And the three most top EHR is Center, Epic, and next slide. Make sure the EHR systems run smoothly, open only one patient record at a time, make sure you use medical terminology, and make sure it has privacy at all times.
Understanding different races and cultural backgrounds in EHR systems is important for treatment, decision-making, helpful for choosing the right medications, understanding the disease risk that comes with it, with patients' health, best quality and care based on personal beliefs and values, and helps understand which diseases affect certain races more than others.
Some of the benefits that we benefit from this system are gender benefits. There are many gender benefits when talking about the EHR system, such as using the system to better facilitate more effective and efficient patient care. When discussing gender and sex EHR system, it allows for more accurately generated health screenings, and it also helps healthcare workers try to create a more timely generation. It allows generations to be more up to par with getting their tests done in a timely manner and keeping their personal records up to date. The use of the EHR system ensures that the correct pronouns are used for the correct client, and I think that is very important and respectful in multiple aspects. Another benefit would be the older physicians versus the younger physicians. A study was done in 2011 that stated that 30.8% of older physicians, older than 55, use the basic EHR, compared to the 40% of physicians ages between 40 and 55, which a test was done in 2015, where physicians who cannot demonstrate meaningful use of the EHRs will be subject to that 1% reduction of the Medicare payments. With other physicians, they prefer paper records rather than the EHR, and it affects them and their clients in a bad way. Because there are many things that could happen with paper records, such as being compromised or lost. And the last effect is the the age group effect. Age groups between 40 and 55 have adopted the new EHR, where most of their records are kept online in a secure application. Age groups are 55 and older still have a habit of using paper records and are comfortable with the old system and is not too fond of change. On a positive note, the percentages of all age groups of the use of the EHR has drastically improved.
And in conclusion, we had a short video on EHR systems before we run through the key points met.
Remember when going to the doctor's office looked like this? Now it looks more like this. Across the country, more and more doctor's offices are using electronic health records, or EHRs. As digital records have become more common, unanticipated problems with design, workflow, training, and how clinicians use them have contributed to patient harm. To learn more, we talked to MedStar Health's Dr. Raj Watwani, a leading researcher on EHR usability and safety.
EHR should make it easier and safer for clinicians to provide care to patients. The suboptimal usability of EHRs can lead to mistakes like selecting the wrong patient, ordering the wrong drug, and missing critical lab results.
MedStar Health's Dr. Terry Fairbanks, who studies human factors in healthcare, explained how a computer auto-refresh error can cause a problem without the doctor even realizing it.
Let's take two patients, Martha Jones and Daniel Rodriguez, who come into the emergency department on the same day and have similar issues, so they both need a chest x-ray. When the doctor goes to see Martha Jones, they pull up the patient's electronic health record to look at the x-ray. And the doctor actually pulls up Daniel Rodriguez's x-ray, thinking that it is Martha's. And this x-ray appears normal, so the doctor sends Martha home. This all happened in a fraction of the second. So let's slow it down to see what actually happened. In between the first and second click, the database updates with new patient information and auto-refreshes. So by the time the doctor finishes the second click, the x-ray icon his cursor was on now belongs to Daniel Rodriguez. Daniel's x-ray looks fine. On the other hand, this is Martha Jones' actual x-ray. You can see there's a large white area here, which represents a pneumonia, which needs antibiotics. Without antibiotics, Martha could get much worse very quickly. This is one example of a health IT facilitated error, and there are many others.
This is a fixable problem, but currently there's not enough research on how and why these errors occur.
All patients deserve the best care possible. We need better data now on how, when, and why these challenges arise so that we can all do a better job protecting our patients.
In conclusion, EHR systems are beneficial to healthcare facilities in its entirety, and most hesitance to adopt the new system are solely based upon misconceptions or nescience. Time efficiency with an avoidance of lack of accuracy, reliability, revenue increase, accessibility to patients, patient-doctor personalization, quality, safety, and so many more pros are evident in the adoption of the new system.